Okay, welcome everyone to our travel health webinar entitled Protecting Patients from Hepatitis A and Typhoid. My name is Tiana Tilley, and I'm the Director of Pharmacy Innovation and Professional Affairs at Whole Health, and I'm joined today by James Morrison.
Hello everybody, it's James from Whole Health, your Director of Pharmacy Excellence.
So we're today going to talk to you about protecting patients from hepatitis A and typhoid, and then this will be followed by a campaign in the fall or early spring about travel health and potentially additional content as well about other vaccine-preventable diseases for travel that you can ensure your patients are up to date on to make sure that they have safe and also enjoyable vacations. We've elected to start with hepatitis A and typhoid because of how prevalent it is across the globe, really. And so we felt like this would be a great topic to start with, so pharmacists can start becoming more comfortable with making travel health recommendations before they expand to full-on travel health clinics per se. So before we start, we just want to disclose that this travel health program was made possible through support from Sanofi Pasteur. In terms of an overview, we'll start with travel health in general. We'll then move to hepatitis A and typhoid. Then we'll talk about how to protect your patients. And lastly, what the travel health program contains in terms of materials and supports.
So Tiana, the past work this banner's done around immunizations has been quite exciting to see how far we've come. And what we're hoping to do is present the scenario in the pharmacy that pretty much any time you see a patient, any interaction you have with them, an opportunity to check in and see where they're at with their immunizations and see if there's been any incomplete immunization series. So we're hoping to prime you all to look for that today. In particular, in my practice, I've seen hepatitis A vaccinations are sometimes forgotten because it's not just a one-off dose. And we really want to make sure our patients are receiving protection, immunity for their lifetime. So, our adult vaccination programs here at the banner have been quite popular within the banner. And on the screen, you can see some examples of past campaigns, including pneumonia, shingles, meningitis. And what we've been hearing from our banner is there's really a big interest to start delving more into travel. So we're here today to get that conversation started.
So a lot of pharmacists have asked what the impact of COVID-19 on travel is and what their role might be because of this. So one of the big things that's come up is that while we might not be traveling right now, this is still an excellent time to start learning about travel health and becoming more comfortable with making recommendations so that once travel resumes, pharmacists are ready to help their patients. And this is going to be big, we think, because a lot of Canadians are already talking about how much they miss travel and they miss their vacation, they miss seeing their friends and family abroad. And so we do anticipate that there will be a large upswing in travel as soon as it is permitted and safe again. What pharmacists can really do is to help people be aware of global health risks. And I think COVID has really played a part in this, making people aware of the risks associated with globalization and making them potentially more open to vaccines and travel health precautions. A lot of patients might have also fallen behind on immunizations. That could be completing travel health series or even routine immunizations. So there's a role in making sure that catch-up is provided and then that doesn't fall completely on other healthcare providers where there might not be capacity. So pharmacists taking on a bigger role in this area is really needed. There might also be new travel protocols in place for various destinations. And so pharmacists can make sure that patients are aware of what resources to use to check these recommendations. And we'll go over a few examples on the next few slides. Some things that might have changed would be things like quarantine requirements, mask and hand hygiene requirements, and those are things that patients should really be aware of. They also might want to select a destination based on COVID risk. So what are the current number of cases and what's the mortality from cases? Those are things they might want to check out to make sure it's safe to travel to those locations, as well as what the re-entry requirements will be within Canada so that they can respect those and protect other Canadians as well. And the role for pharmacists will be not only providing that information, but also these travel health immunizations. Now, these are some COVID-19 travel resources. These might become more common in your practice as pharmacists play a role in travel health immunizations. One of the reasons why pharmacists might play a bigger role in this area is because a lot of travel health clinics might not yet be open to seeing patients in person, or they might have closed after COVID. It could also be that pharmacists really maintained a good sense of community throughout COVID, and their patients trust them for information related to COVID, and so they might come to you for guidance. So we do have two resources here. On the left, we have the CDC's resource, which is a COVID-19 travel recommendations by country interactive map, where you can see different countries and what the risk level is in terms of COVID-19. The map tells you what the number of cases reported were even the prior day, so it's essentially in real time, as well as the total number of new cases and travel recommendations. One thing to keep in mind is that the CDC is an American resource, and so it can likely be used more for travel outside of North America, but isn't necessarily what you'd want to go to for recommendations in terms of patients traveling to the United States or back from the United States.
So that's a really great point, Hannah. And if you're looking for more Canadian guidance, you can go to the federal government website on the right-hand side of your slide, which details not only recommendations for traveling outside of Canada, or it really deals mostly with traveling to Canada and also within Canada, which is something that's happening now that we can't really go abroad so freely with COVID.
So now a travel health overview. In terms of the impact of travel-related diseases, a lot of people think these might be mild annoyances like ruined travel plans and vacation days, which they've worked really hard for and really have deserved, but that may not be so big in the grand scheme of things. But when we think of how serious travel-related diseases can be, we actually learn that it can actually, in severe cases, lead to death, long-term complications, and even hospitalization visits abroad. On the more lighter side, it can still interfere with events and business meetings. This can include weddings abroad, where people really have that one day to celebrate, business meetings where there's that one day to make that interaction and that connection. And they can also bring with them opportunity and treatment costs. So missing that hard-earned travel day or even having to pay for treatment or a day visit to a hospital can be quite expensive. Now, when you're talking to patients about these costs, it's important to talk to them about the upfront cost of potentially preventing things versus the long-term cost that can be even greater if they end up actually experiencing a travel-related disease. Now, I've put up on the slide a few of the vaccine-preventable travel diseases. These include things like traveler's diarrhea, hepatitis A and B, Japanese encephalitis, meningitis, rabies, typhoid, and yellow fever. And the good news is that pharmacists have a role to play in providing immunizations for these vaccine-preventable travel diseases. Now, for some of them, and depending on the province that you're practicing in, there might be different requirements, but we'll walk through what those are and how pharmacists can play a greater role in some or all of these. So as we mentioned, we'll start specifically with hepatitis A and typhoid. So hepatitis A is a virus that causes liver disease, and it can cause long-term liver consequences. Typhoid is an infection of the intestinal tract caused by Salmonella typhi, which can actually lead to severe illness and even death. So something we really, really want to prevent, and something that every year Canadians actually experience as a result of travel. Now, one big question that patients might have and healthcare providers might have is what areas are at risk of hepatitis A and typhoid? Well, we really commonly see things like the Caribbean, so Cuba, Aruba, Barbados, and I think a lot of patients are really aware that before they travel to these locations, they need a Hep A and typhoid vaccine. Some other areas that are high risk for both hepatitis A and typhoid include South and Southeast Asia. So if a patient mentions that they're visiting family or going on a business trip, even traveling abroad or backpacking to places like India, Pakistan, Thailand, and Laos, that's a great opportunity for pharmacists to mention that this is a high-risk area for Hep A and typhoid, and they should ensure that their vaccines are up to date.
I know, Tiana, this talk is about travel medicine.
This talk is about travel medicine.
Folks from who are not traveling,
that doesn't preclude folks
vaccines
from who are not traveling requiring certain vaccines we're talking about here today.
Canada,
I know
there is still some risk, in particular for certain individuals with regard to hepatitis A, and in some provinces like Ontario, you can even get that through the public health if you're within certain groups. And those groups include IV drug users, folks with liver disease, and also men who have sex with men. But I can recall living here in Toronto with migrant workers coming in and out of the city. There's been cases where public health has to shut down restaurants because of hepatitis A exposure due to food handlers who had the disease. So it's something that's I would consider even if you're not planning on traveling.
Exactly, and that might also be a reason why patients might want to ensure that they've completed the full hepatitis A series, because they might not be traveling again in the near future, but it could be something that they experience later in their life, or something that they might just want protection for because of other lifestyle risk factors. So another thing that I think sticks out when we look at this page is that there are a lot of regions represented. Essentially everything but Oceania has risk for hepatitis A and typhoid. So it's a pretty safe recommendation to say if the patient is traveling, you should look up if the country and the region is specifically at higher risk. Some of the intermediate risk countries and regions include South America, Africa, and the Middle East, with at-risk areas including Central America and Central and East Asia.
Yeah, I think in general in marketing materials, we've done a good job here in Canada of promoting hepatitis vaccination, but without delving into these resources, it wasn't on my radar as much about typhoid, meaning that for very popular travel destinations like Cuba, something to think about because I've been to a lot of these countries and never received a typhoid vaccine.
But you will now.
Yeah, next time.
And so one thing that kind of goes with what James is saying here as well is that there might be popular times where people might be traveling to areas where Hep A and typhoid are more prevalent, and those are things to watch out for. So travel before March break, maybe travel before the winter holidays. You might also see a larger number of backpackers after graduation, for example. So those are some key timeframes to look out for travel to areas like South and Southeast Asia. Now, another question might be, who's at risk? And the long and short is really everyone who travels to areas where there is higher risk is at risk. There are certain groups that are particularly at risk that we truly, really want to make sure are immunized. But as a general rule, everyone traveling to these areas should be immunized. These at-risk groups include older adults or people with comorbidities. This is because they might be at increased risk of complications from things like typhoid and hepatitis A. People who are visiting friends, family, or returning to their home country. There's a misconception that often if someone was originally from a country that has hepatitis A or typhoid endemic, that they actually have protection and don't need to be immunized. But that's actually not the case. They might have been away from the country for 10, 20 years, and they no longer have that protection that's waned. So they need to be immunized before returning.
Yeah, that's a very important misconception that pharmacists can help patients with, because you get to interact with them as they're planning to go away. They're there stocking up on their medications. We'll take a moment to check in and see what the vaccination requirements are for that country where they're headed to, and are they up to date?
Yeah, another thing that people might not think they're at risk for, but really are people attending business meetings or eating out. Oftentimes when people are attending business meetings abroad, they really want to make sure that they're able to attend that meeting and they can't risk getting sick. Another thing is that they might feel a bit of pressure to adhere to social norms or the recommendations of their international colleagues in selecting a restaurant or a location to eat out at. And they might end up eating in a place where maybe they wouldn't have picked if they were trying to reduce the risk of hepatitis A and typhoid. The last category here that we've also included is people who are doing adventure or budget travel, as well as humanitarian travel, as they might go to more rural areas where there might be higher risk. The last thing that I'd like to point out on this slide is that people of any age, and even those staying at 5-star resorts, can be at risk. Another misconception is that, well, I've spent a lot of money, I'm staying at a very, very nice place, I can't be at risk. But really, risk could be with that day trip that they've booked kind of separate from the resort, where they go snorkeling and where a meal is provided, and they end up being at risk because of ice that's in a drink there. So there could still be risk. It could also be from people who might be working at the resorts if they're carriers of things like typhoid, or even if ice is getting into the drinks at the resort. Even though the water comes from a bottled source or is boiled, the ice might not necessarily come from that as well. So this kind of goes to how is hepatitis A and typhoid spread? And really it's transmitted via fecal oral route. And so some common areas of transmission include raw fruit and vegetables, things like a salad bar at a buffet, undercooked meat and seafood. This could be things that were either at a buffet at a resort or even at the market or street vendors, tap water and ice cubes. And for hepatitis A transmission, it can also include things like sexual activity or sharing drug use equipment. And these are things that might occur more commonly when people are traveling and really enjoying their vacation. One other way where hepatitis A is spread is through contaminated blood or blood products. So if anyone actually ends up needing medical aid abroad, they could actually end up being at risk for hepatitis A through that transmission route as well.
Yeah, that's important, because no matter how much you plan, you never know if there's going to be an accident and you need to access local healthcare. So certainly something to be top of our mind when we're having these conversations with patients.
So speaking of how it's spread, we have a little trick to remember how to prevent hepatitis A and typhoid, and that's the saying, boil it, cook it, peel it, or forget it. So those are some really helpful tips to give to patients in terms of what to eat and what to avoid. Other things include washing your hands, so regularly as well as before any meals. And the last one is getting vaccinated. And we know that vaccines are the most effective way of preventing vaccine-preventable diseases. And so we really want to recommend this if the patient is traveling to an area where hepatitis A and typhoid are endemic.
Yeah, that's good advice, but we certainly don't want to forget vaccines aren't always 100% effective. So while we're giving those vaccines, reminding patients of these other precautions they can take, boil it, cook it, peel it, or forget it, is a very helpful reminder for patients.
Okay, and with that, we'll talk about protecting your patients. So pharmacists' scope of practice has expanded, especially in recent years, to include injections. And in many provinces, this includes injections for travel-related vaccines. Now, scope of practice varies from province to province, and there can actually be differences in the schedule of the vaccine from province to province. Even though NAPRA exists, different provinces might have different schedules that they've adopted as well. And there might be differences in terms of administration or prescribing within scope. So when you're practicing in your province, do make sure you verified what's within your scope. And if you have any questions about your scope of practice, feel free to reach out to James or myself, and we can provide guidance on this. We can also provide the references for where this information in the slide deck has been found. For today's presentation, we'll focus on scope of practice for administering in Alberta as well as in Ontario. So in any province, you want to make sure that you are injection certified and that you have a valid and up-to-date first aid and CPR. Some of these recommendations, again, have been changed a bit because of COVID and the impact on recertification. But if you have questions, again, reach out to us and we can help provide clarification. In Alberta, pharmacists can administer any intramuscular vaccine to patients who are 5 years and older. They consider travel vaccines Schedule 1 per NAPRA. So this includes hepatitis and typhoid vaccines. Pharmacists who have APA can prescribe, whereas others without would require prescription either from a pharmacist with APA or another prescriber like a physician or nurse. When we look at scope of practice in Ontario, we know that pharmacists can administer 13 vaccines at the moment, in addition to influenza, and that this includes hepatitis and typhoid. They can administer vaccines to patients who are 5 years of age and above, and again, the vaccines are Schedule 1 per NAPRA for hepatitis and typhoid. Pharmacists can't independently prescribe hepatitis or typhoid vaccines, but they could do so under a medical directive or by filling a prescription from a registered prescriber, like a nurse practitioner or physician.
Some folks here in Ontario may have heard about scope of practice coming for providing injection services to patients as young as 2 years old. In the time being, that hasn't been enabled yet, and that scope, as far as we know, will only apply to flu, so not for travel medicine.
So when we look at hepatitis A and typhoid, there's a few different options in terms of which vaccine to recommend and to administer. And we'll walk through the different options so that the pharmacist can help make the most informed recommendation that's the best and most appropriate for their specific patient. The first thing that we have here is the combined hepatitis A and typhoid vaccine, which is called VIVAXIM. And this is the only combined hepatitis A and typhoid vaccine available on the Canadian market. One important thing to note is from an efficacy perspective, there's equivalent seroconversion rates achieved with this combined product versus the individual vaccines for both hepatitis A and typhoid. One reason why patients might want to use this is if they're going to one of the countries where both hepatitis A and typhoid are endemic or at high risk. This can minimize the number of vaccines required, which is especially important if they're getting a lot of different vaccines. So for example, if they need hepatitis A, typhoid, yellow fever, meningitis, you're running out of limbs. So it's nice to be able to combine it into one, reduce potentially some of the sites needed, and also potentially some of the side effects that are associated with intramuscular injections.
Yeah, that's a very good point about the benefit of having some vaccines available in combination. As in my practice, maybe I should have paid more attention, but it never really came to my mind that VIVAXIM needs to be re-immunized every 3 years to provide immunity. So perhaps, while we're offering that vaccine, is something to remind patients of, and perhaps even schedule a follow-up in 3 years if that's your regular patient, if they're still actively traveling, and making sure that they don't forget that.
Exactly. So really key points about VIVAXIM being that hepatitis A would be 1 dose now, so 14 days before travel, and then a second dose 6 to 36 months later for long-term protection. So the patient might receive 1 immunization before they travel and then follow up with you, or you can follow up with them to make sure that they have that long-term protection by completing the 2-dose series. For typhoid, we know that every 3 years, like James said, with VIVAXIM, we need to receive another vaccine in order to get that boosted protection. Now, some patients might want to complete the series for hepatitis A as soon as it's possible, so at that 6-month mark. Some may elect to wait because they know they're not at risk, or they're not traveling again, so they'll wait until the 3-year mark so that they get that hepatitis A completed series, as well as another 3 years of typhoid protection for a total of 6 years. Now, in some cases, a patient might have started the vaccine series with a monovalent vaccine. So, for example, one of these hepatitis A vaccines, and then they might complete the series with VIVAXIM. It could even be vice versa. So they could start with VIVAXIM, and then their second dose might be one of the monovalent hepatitis A vaccines. All of those vaccines have an efficacy around 90 to 97% in preventing clinical illness of hepatitis A. Some things to consider would be when that second dose is appropriate to administer. There are different amount of time that must have passed after the first dose for different vaccines. So for some of them, it's 6 to 36 months, whereas others, it might be 6 to 12 or 6 to 18 months.
Yeah, so with this variation, I think it's important to have that conversation with the patient when they're getting that first dose. We know hepatitis A requires 2 doses, so plan for that second dose, while you're providing the first, and get that prescription in place so that everything's good to go for when it's time to administer.
Exactly. Now, these are the adult options available, and you can see the age requirements as per the indication for each of these vaccines. For some of them, there are also pediatric formulations that are available for children. Now, in terms of typhoid vaccines, again, comparable efficacy to the combined hepatitis A and typhoid vaccine for typhoid, which is about 50% effective in preventing typhoid. And so again, that's a reason why we want to immunize, but we also want to educate on the boil it, peel it, or forget it. So for typhoid, we have 2 vaccines that can be used. We have Typhoid V or Vivotif that are separate from the combined VIVAXIM vaccine. One of these, the Typhoid V, is an intramuscular injection that needs to be provided every 3 years for ongoing protection, similar to VIVAXIM. The other is an oral live attenuated vaccine called Vivotif. And so this can provide protections for 7 years at a time, but it's a bit more complicated, or I guess quite a bit more complicated, and there might be some concerns about adherence. So the recommendation here is to really only recommend it if it is a patient that you feel comfortable and that they feel comfortable adhering to the administration so that they do achieve that full protection. So the recommendation in how to dose this is 1 capsule by mouth every other day for 4 capsules. And some other things to also keep in mind are that it needs to be stored in the fridge, and it also needs to be separated from food, either an hour before or 2 hours after a meal.
So that's a pretty complicated administration schedule, Tiana. So it's unfortunate that the 2 products don't have the same duration of immunity, but it seems like an injection is certainly a simpler way to ensure compliance.
Yeah, the injection's often appreciated by patients because they know as soon as they leave, they've gotten that protection once 2 weeks have passed. And they don't have to worry about, did I do it properly? Have I forgotten anything? Especially when they're trying to get so many things together before their travel. Another thing to consider is that the Vivotif is a live attenuated vaccine. So other things coming into play in terms of if it needs to be separated from other vaccines, or which patients it might be appropriate for versus which patients might be immunosuppressed. Again, because it's an oral vaccine, there's also additional side effects that are a bit unique to it. So things like abdominal pain, vomiting, headache, and nausea. However, if your patient is needle averse and we can't do virtual reality during the injection, for example, then this might be an option for them.
Thank you, Tiana. That sure was a lot of information. So to help us digest it, how about you take us through some cases? The first case we have today is Sana. She's a 26-year-old woman, and she's going to Barbados for the first time since she immigrated to Canada when she was 9 years old. She's staying with her family in Barbados. So she's up to date on all of her routine immunizations, but she's wondering if she needs any travel vaccines.
Okay, so the first step that I'd recommend is to look up on the CDC's Travelers Health webpage what the recommendations for Barbados are. And we'll include the link to this resource later in the presentation so people can access it. Once you put in Barbados as the travel destination, it'll provide an explanation of which vaccine-preventable diseases the patient should be immunized against and the specific recommendations for those vaccines. So I've copied it onto this slide here, and we see that we need routine vaccines for all travelers. So in the case of Sana, she is not due because she's up to date on all her travel vaccines. So we don't have to go over this, but for other patients, we'd want to make sure that they're up to date on things as well. We know that hepatitis A is also recommended for all travelers to Barbados, and in Sana's case, she hasn't received this vaccine, so we'd want to make sure we get her that today. For hepatitis B, it's recommended for most travelers. In Sana's case, she actually went to school in Canada, and so she completed the Hepatitis B immunization series through the publicly funded school-based program. So that isn't needed for her. In terms of rabies, it's recommended for patients traveling to remote areas who might be in contact with bats. And so that doesn't fit the description of Sana's travel, so we won't recommend it today. For typhoid, it's recommended for most travelers, and this would include Sana. And yellow fever is required if traveling to Barbados from a country where yellow fever is endemic. Because Sana is coming from Canada, we know that yellow fever isn't endemic, and so it's not required. So in summary, for Sana, we want to recommend hepatitis A and typhoid. She might ask you, so why isn't hepatitis B immunization required, since I saw on the CDC website that it might be for travel to Barbados? And so this can be where pharmacists can explain to patients and even other prescribers that many residents of Canada have actually already been immunized against hepatitis B. This includes a lot of different groups. In Sana's case, it included routine publicly funded programs like the infant birth programs or school-based programs, where depending on the province, in grades 4 to about 8, Canadians receive immunizations against hepatitis B. And that started in the late 80s, early 90s, so a lot of younger patients would have completed this already. In addition to that, there's also many different patients who are included in the high-risk publicly funded programs. So patients who are at risk due to lifestyle risk factors, so people who inject drugs, men who have sex with men, or patients who have a history of sexually transmitted infections. It also includes patients with medical comorbidities, so people with liver disease or renal dialysis. They would have also been eligible through public health or their primary care providers. On top of that, persons who are new to Canada, so those arriving from countries that are endemic with hepatitis B, those who are household contacts or children from those countries, they would also have been immunized likely when they immigrated to Canada. And a lot of workers have been immunized because of potential exposure. So this includes healthcare workers, emergency service workers like police officers and firefighters, childcare workers like early childhood educators and teachers, as well as correctional facility staff.
Well, Tiana, what I'm getting from that slide is that we have pretty widespread vaccination coverage for hepatitis B here in Canada, whether you're recently coming to Canada or you are growing up here in Canada. So maybe when we're looking at hepatitis vaccination, we should be focusing more on the hepatitis A. How can we get those vaccines for patients? And perhaps we could even spare a needle or two, because looking at Twinrix series, there are usually 3 or 4 doses. And we know hepatitis A, you can have that with just 2.
Exactly. So it's really important to have that conversation with patients if they fall within any of these categories, or if they have their immunization records available either at home, at public health, or at another provider to check if they've already received hepatitis B immunization.
So let's revisit our case. So Sienna's back at the pharmacy. It's been 3 years, and she's going on her honeymoon to Laos for 2 weeks with her wife, Deja. She hasn't received any vaccines beyond her flu shot since she last saw you 3 years ago. She's wondering if she needs any travel vaccines or boosters.
Yeah, so again, you go to the CDC Travelers Health website and specifically input Laos, and it will show which vaccines are recommended and some comments about who they're recommended for. So for routine vaccines, we know that Sienna is up to date, so none are due today. For hepatitis A, we know that she was immunized 3 years ago with the first vaccine in the series, but she hasn't completed the 2-dose series, so she is now requiring the last vaccine for long-term protection. For hepatitis B, like we already said, she received this through the school-based program. For Japanese encephalitis, the recommendation is that it's required for travel lasting a month or longer. And so unfortunately, her travel is only 2 weeks, and so she won't be requiring that. We know, again, she's not going to an area that will be in contact with bats, so things like caving or splunking, and so she isn't requiring a rabies vaccine at this time. For typhoid, we did provide her with VIVAXIM 3 years ago, but we know that the injectable typhoid vaccine requires another dose every 3 years, and so she's eligible and should be immunized again for another 3 years of protection. And lastly, she's coming from Canada and thus doesn't need a yellow fever vaccine. So this is a visual representation of the vaccine administration that Sienna has gone through, specifically using VIVAXIM. So her first dose was prior to her Barbados trip, and we want this to be at least 2 weeks before travel, and to ensure the full protection that's possible and that immune response has been mounted before actually arriving in the country. Then we wait 6 to 36 months. Now in this case, it was the 36 months because it's when she was again at risk for typhoid. And now we're administering the second dose pre-Laos at that 36-month mark, 14 days before departure at least.
So Sienna was so happy with the vaccination services offered at the pharmacy. She's now brought her new wife, Deja, and they're both going on the honeymoon together to Laos for 2 weeks. Deja is up to date on her routine immunizations. Last year, she received a dose of Havrix 1440 prior to a business trip. She's wondering if she needs any travel vaccines or boosters.
Yeah, so again, we go to the CDC's website and their recommendations. We know that Deja is up to date on routine vaccines, but for her hepatitis A vaccine, she did start her protection with Havrix 1440, but that was a year ago. And so she's now eligible for another dose to ensure that she has that long-term protection. So like we mentioned earlier, this could be completed with any of the hepatitis A, either monovalent or combined hepatitis A and typhoid vaccines. For hepatitis B, she's also received it through the publicly funded program. The travel to Laos, unfortunately, is less than a month, so she doesn't require a Japanese encephalitis vaccine, and they won't be in contact with bats. She will potentially be at risk for typhoid, and she hasn't received a vaccine previously in the last 3 years with typhoid protection because she got the Havrix vaccine last year, which only provided protection against hepatitis A. And so we do want to ensure that she gets a typhoid vaccine today. And again, the yellow fever vaccine isn't recommended since she's traveling from Canada. So for Deja, we also want to administer hepatitis A and typhoid vaccine. In this case, the administration schedule could look like this. So her first dose was Havrix 1440, 2 weeks prior to her travel in December of 2019. Now 6 to 12 months has passed. We're at the 12-month mark, and her second dose is due. In this case, she wants not only to complete the hepatitis A series for long-term protection, but she also wants new typhoid protection. And so in this case, it would be appropriate to complete the series with VIVAXIM.
So on the slide here, Tiana, it says to have the second dose about 6 to 12 months later. So what do we tell a patient if it's been much longer than that? Do they need to start again?
Well, for hepatitis A, we just want to ensure that they do have the completed series. As long as they get that second dose with one of the vaccines we've talked about here, they'll still reach the same final concentration of antibodies and that same amount of protection, even if there was a delay or an interruption in the immunization schedule. So it is okay, even, for example, if it was 18 months after the Havrix, we could still provide her with VIVAXIM. We wouldn't have to restart the hepatitis A immunization series.
That's great, and it's a real opportunity for pharmacy to look at past records and see if there was any Havrix prescriptions that weren't refilled.
Exactly, and I think this will be really important, especially with the interruption that COVID might have brought. A lot of people might have missed that second dose or even third or fourth dose of some vaccines for travel vaccines and even routine immunizations. And this can be applied to many immunizations according to Health Canada's immunization guide. Now, there are some exceptions, but we'll refer you to the immunization guide for those. Now, we'll talk specifically about our travel health program.
So once we're ready to gear up for travel health, you'll be receiving certain materials from us, or they'll be made available, including posters to advertise your travel health services. We'll give you recommendations on running reports to identify patients, in particular looking for those vaccines that might be lost to follow-up or have been delayed throughout this pandemic. We'll encourage you to screen patients at every opportunity to look for their immunization history, but also inquire about future travel plans as it becomes the norm to travel again. There'll probably be lots of opportunities there to interact with patients and support them with those plans. We have pharmaceutical opinion templates that will help obtain prescriptions for these travel vaccines and provide guidance on administration of vaccines and also documentation to collaborate with prescribers and inform them those doses have been given. And you'll want to make sure that you have those follow-up appointments booked now with prescriptions in place for those vaccines that form part of a series. So in particular, today we've been talking a lot about hepatitis A, so making sure that those second doses are not forgotten to ensure that we have lifetime immunity.
Yeah, we definitely want that long-term protection and to make sure patients are up to date on their vaccines. Some patients might ask for you to write down the prescription recommendation. This could be the case if their prescribers maybe don't respond to faxes or if, depending on the model that's set up for the prescriber, if they need to actually see the patient in person, because there might be an appointment fee for travel specific recommendations since it doesn't fall under OHIP coverage. So that might be something you can do by actually providing them with the paper that has the recommendation on it. Similarly, the recommendation could be used as a pharmaceutical recommendation, but you wouldn't be able to necessarily bill it as a pharmaceutical opinion.
One comment, I think in my mind thinks a lot about Ontario's scope of practice, but if you're an EPA pharmacist in Alberta and you've assessed a patient, they're going on a trip and they meet the requirements needing that vaccine, you can go ahead and prescribe it and give that dose.
So some of the opportunities to have proactive conversations are available for pharmacists as well as pharmacy team members, as long as we keep our eyes out for kind of hints that the patient might be traveling. So for people like a pharmacist or a pharmacy technician, this could be noticing that a vacation supply is being filled, or a prescription like azithromycin is being prescribed for traveler's diarrhea treatment, or antimalarials are being dispensed. For someone like a front shop manager or even a pharmacy assistant, it could be watching for patients who purchase things like travel-sized products, sunscreen, bug spray, electrolyte replacement, and asking the patient, oh, are you going away for travel? And if they say yes, then saying, are you up to date on your travel vaccines? Or did you know there are recommendations to get immunized before you travel? And if the patient isn't aware or isn't up to date, making that referral to the pharmacist to assess the specific country and risk factors to see what vaccines and other precautions might be required to protect the patients. Now, I did reference in the cases the CDC's Travelers Health resource. On the screen to the left, you can access this site by clicking the link. You can actually select the destination. So for example, Barbados or Laos, like in the cases, and that will provide you with a screen like you see on the right, where it actually provides the recommendations from CDC for vaccines and medicines for those specific areas, and also what the recommendations are in terms of which patients might benefit from that recommendation. So I highly encourage this site, especially if you're not yet travel clinic ready and you might still be in the early steps of finding out which countries have which recommendations.
Yeah, I don't think your patient would mind if you take a few minutes to check, because they want the best information, and these are great resources.
Yeah. Now, these are the travel health program materials that James mentioned you'll be receiving. We will continue to watch the COVID situation and see at what point people are starting to resume travel at higher rates and when it's most appropriate to send these things out. But if you need them prior to that, please do let us know and we can send you a special package with them. And there's a lot of things, including pharmacy education, in-pharmacy marketing materials, as well as operational supports for you to use. Now, if you're interested in learning more, we'll continue to provide education on travel health, but in the interim, there's some additional resources you can access. On the left of the screen, there's accredited CE lessons, as well as articles, videos, and websites you might want to access that Sanofi Pasteur has developed or made available. On the right, there's also the International Society of Travel Medicine, where people who are healthcare providers like pharmacists can receive their ISTM certificate of knowledge. Now, this would be especially necessary if you perhaps wanted to practice in provinces where an ISTM certification is required to either prescribe or administer certain travel health vaccines, or it might be helpful to have if you wanted to really specialize in travel health and open a travel health clinic in your pharmacy. So here you can see the link of additional details for that certificate, as well as when the next examination coming up would be and the requirements for that. Now this brings us to the end of our webinar for today. So thank you so much for listening. If you have any questions that come up after you've listened, or even as you're starting to integrate this into your practice, please feel free to email myself at tiana@wholehealthrx.ca or james@wholehealthrx.ca, and we can help you with whatever questions or concerns you might have.
Thank you everyone for listening, and thank you, Tiana.